Good afternoon. I'm George Latimer, Westchester County Executive, and I'm here on Monday, March 22nd, for the first of our two updates for this week on the coronavirus outbreak here in Westchester County. I'm joined, as I always am, by our Deputy County Executive, Ken Jenkins. In a few minutes, we'll introduce you to the Mayor of the Village of Ardsley, who will be our guest visitor today to talk a little bit about what's happening in that community relative to coronavirus and any other issues that are important in the Village of Ardsley. Our numbers for today, we do not yet have the New York State tracker up for Monday, so we're working off of Sunday's numbers. As of yesterday, we had 5,233 active cases of coronavirus in Westchester County. That number continues to come down on a steady basis for the last 7 weeks, but the numbers have not dropped dramatically over the last week to 10 days. A week ago, that 5,200 number was 5,367. 2 weeks before that, 5,930. And 3 weeks before that, it was 5,976. So we've had a drop from a peak of about 11,500 active cases in the middle of January and dropped very dramatically over the course of the month of February into early March. Now, the last 2 weeks, those numbers have been dropping much less aggressively. So at 5,233 cases, however, we are at the lowest point that we've been since late November. So that is a good sign that we've gotten through the holiday spike, and it's well behind us now. We have, at the last time we've tracked, which was Saturday numbers, 256 people hospitalized for coronavirus. Similarly, that number has dropped dramatically in the last 7 weeks. It was at a peak of 588 people hospitalized, so down to 256. That's a very good diminishment. But the week-to-week comparisons have not been that dramatic over the last few weeks. The week prior, we were at 253, which was slightly below. We were up to 270 the week before that. 3 weeks ago, 340. So there is a definite diminution in the amount of hospitalizations. That really shows the depth of the illnesses of individuals if the number of cases shows the breadth of them. And then in terms of fatalities, as of yesterday, we lost 2,168 individuals, and that is a loss of 22 individuals over the last week. Every death is a tragedy. We don't treat people as numbers, but we do try to understand what trends are happening. That 22 fatalities in a week is down dramatically from weeks where we had 55 and 65 people per week. However, we do seem to be reaching a point where the numbers are flattening out, and we'll see what the next couple of weeks represent. At some point, the rise in the vaccination numbers should start to see the next significant downturn in the number of positive cases, and we'll look to see that. We do know that there are variants out there that indicate that the virus in its mutations have become more dangerous in the sense of greater people getting the disease. It's much more communicable. We don't know yet if it involves greater fatality or greater degree of illness based on hospitalizations, but we have to see the presence of those variants, and we've heard about Brazil variant, South African variant. We have had a presence of the UK variant in the county over the last 3 weeks or so, and so we haven't seen that create a similar impact. But we'll leave the detailed discussions to the scientists. We are not the scientists. We're really tracking in a real-world time what's happening so that we can take action as best as we can, as a local government does, between the county, the towns, the cities, and so forth, by doing things such as vaccination and testing, administration of PPE to try to reduce the spread, and so forth. On the vaccination front, our numbers through yesterday, the county center has issued a total of 125,000 vaccinations. That is a significant amount. The county center has been up now for 2 months, vaccinating probably 7 days a week, 11 hours a day on a constant rotation. The Armory in Yonkers has jumped up to 16,000. They've been open just less than a month. And the two county clinics together have combined for 25,000 vaccinations. So the totality of those three, counting the Armory numbers, 176,000 vaccinations. And when we go to New York State, they have a tracker in which they identify that 150,000 Westchester residents have completed the vaccine series, and 289,000 have at least one vaccine dose. That's out of a total population of 1 million people. So if you do the math, it's pretty simple. On a base of 1 million people, you're talking about having 15% have completed their vaccines, having both vaccines if it's Pfizer or Moderna, or one if it's Johnson & Johnson, and an additional almost 29% people, when you include that 15, that have had at least one vaccinated dose. So that's a good sign for the number of people. We're at the 30% mark, and we want that to continue to rise. We want to talk a little bit more about what the governor has outlined in terms of vaccination availability, which now opens it up to a larger cohort of Westchester residents. We should see those numbers start to rise. But first, I'd like to introduce the mayor of the village of Ardsley, Nancy Kabulian. Nancy has been a good colleague and friend. We were just in her village over the weekend for a rally that was sponsored by Asian American high school students at Ardsley High School to speak out against the Asian American hatred, and Nancy was one of the speakers there, and she's been a terrific leader, and we're very happy to have you with us today. Mayor Nancy Kabulian.
Thank you very much, County Executive George Latimer. I'm thrilled to be here. I appreciate the invitation. Thank you, Ken Jacobs. As the county executive said, I'm the mayor of the village of Ardsley. We are one of the smallest villages in Westchester County with little over 4,000 residents. We currently have 386 reported positive cases since the beginning of reporting of the pandemic, which is a little bit less than 10% of our population. Fortunately for us, the numbers have really leveled off. Our real peak came in December, January, and February, where almost 50% of our numbers occurred. Since then, in the month of March, we've only had 14 reported cases. In the last 2 weeks, we haven't had any reported cases. So I'm really encouraged that people are getting vaccinated and that people are still maintaining social distancing and wearing their masks. We're looking forward to the opening of schools on April 19th. We're working very closely with our school district to make sure that the traffic is under control and that the kids get back safely into school, and we keep an eye on the numbers going forward. All of our police department has been vaccinated. Every one of our firefighters who wants a vaccine has had the opportunity and has been vaccinated. Our ambulance corps has been vaccinated. We're looking forward to having our front-facing employees in Village Hall being vaccinated. So I really see this as very encouraging signs for the village. As I said, Ardsley is a small village, so our resources are a little less than other municipalities. So I am eternally grateful for the county executive's weekly updates on the coronavirus. We meet with all the other municipalities by phone. Early on in the pandemic, it was 3 days a week. It's been reduced back to 1 day a week now. But the information that's provided, the sharing of information, the sharing of ideas, the sharing of interpretation of the governor's executive orders has been invaluable, especially for a small municipality like Ardsley, where we couldn't keep up with this information as fast as it was coming back out of the state at some points during this pandemic. So I am really thankful for the partnership that the county executive, his administration, and every employee here in the county has provided for not only Ardsley, but for all municipalities. So thank you very much. It's really been, you've always been a great partner, but during this past year where we went into uncharted waters, where no one knew what was going on, your leadership and your guidance and your help has truly been invaluable to the residents of the village of Ardsley so that I can help them and we can help everyone that we represent. So I truly thank you for that. We had a very great rally. I appreciate the fact that the county executive came and he spoke, and Ken Jacobs was there, Andrea Stewart-Cousins was there. We need to keep addressing issues of hate in our communities, so we will stay on top of that, and we will work towards a community where we are all welcome and racism is wiped out. So again, thank you for having me. I appreciate being here and for all your hard work.
Thank you very much, Madam. Thank you very much, Madam Mayor. That's Mayor Nancy Kabulian of the village of Ardsley. And I have to say that Westchester is a pretty big county, and I live over on the Sound Shore portion of it. I grew up in Mount Vernon, but I travel the county relatively frequently. And whenever I'm in those river towns, Ardsley, Hastings, Irvington, Dobbs Ferry, Tarrytown, Sleepy Hollow, I see a tremendous coordination between the local mayors, that they work together on different projects, they like each other, and they find that common interest in that area. And so, Nancy, you've been a leader in that group, and thank you for your leadership as well. On the information that we received today, Governor Cuomo made the announcement that now, if you are age 50 or older, you are eligible to receive the COVID-19 vaccine. That begins with appointments tomorrow morning as of 8 a.m. All of the different locations are eligible to give you your vaccine at age 50 and above. For those who just turned 50, this is something to be happy about. Most people who turn 50 are pretty unhappy that they've reached that age in life. They thought they would continue to be younger than that, but those of us who've long passed 50 look back now longingly at age 50. But we're happy that we get that next cohort of people in to get vaccines. That makes Ken Jenkins eligible now. But most importantly, what's critical here is that we want to vaccinate everybody in this society now. So far, the vaccinations have been a matter of personal preference, and we're seeing that there is still much greater demand than there is a supply of vaccine. We're seeing a growth in the supply of vaccine from the federal government as they work with the pharmaceutical companies and the distribution to the states, and then the states' distribution down to us at the more localized level. But there's still more people that want the vaccine. We're hopeful that over the months of April and May, we will be able to vaccinate enough people, given the size and the scope of the vaccination process from some of the standard locations, as well as local pharmacies, the pop-ups that are coming all over the place. And in so doing, reach that point at which 60, 65, 70% of Westchester residents are vaccinated. And then we will have to deal with the fact that there is a cohort of individuals, however large or small that is, that at this point are not comfortable or don't choose to be vaccinated, either now or in the future. That is an issue to be dealt with down the line. But for right now, the more folks that we get vaccinated, the less likely the disease spreads. The less likely the disease spreads, the less hospitalization, the less fatalities. And so we're hopeful that will happen. So starting tomorrow morning, 50 and older, the Am I Eligible checklist that exists when you go online. It's one of those connections that will show you at the bottom of the screen. When you click onto that on our COVID-19 information from the state, it's been updated for individuals with comorbidities or underlying illnesses as well, so that you'll be able to see exactly what puts you into the various levels of eligibility. If you are eligible at any age because of an underlying health situation, a doctor's letter, medical information, which would evidence that, or a signed certification will do the trick to put you as well into the vaccination pool. And we are hopeful that as more vaccine becomes available, the governor will make announcements that will lower that number as we go through our time. But at this point, starting tomorrow morning, if you're 50 and older, you're eligible for the vaccine. You're also eligible at any age if you have an underlying health issue or comorbidity. You're also eligible if you're part of a long list of different occupational areas in which you face the public, and we want to make sure that you too are vaccinated and reduce your risk of the disease. That long list, now it's got much, much longer than when we first started out, and you can go on the website. Our website will connect you as well, and we'll be able to tell you what those different occupational cohorts are. And of course, the state has announced that pharmacies can now vaccinate New Yorkers with underlying health issues. Previously, the state had targeted local vaccinations at pharmacies to those who are 60 years of age and older, and also for teachers. Now that has broadened, so that if you go to your local pharmacy, if they're one of the pharmacies that are issuing COVID shots, you now can do that if you have an underlying issue. And I've just mentioned the categories: doctor's letter, medical information, which shows that you have a comorbidity, or a signed certification. All of those are eligible, and you can do that at your local pharmacy as well as at the other vaccination centers that we've discussed. Our paratransit system, Westchester County's paratransit system, has now been opened up to offer free transportation to senior citizens and disabled residents who may not be already registered with Paratransit, and you're eligible to receive the COVID-19 vaccine. The transportation will take you to your point of vaccination and bring you back. And that relieves the concern about transportation that many people have because they don't drive, don't have access to somebody who drives, certainly not going to be comfortable taking public transit to go to take a shot and then come back from that. So now our paratransit system can be used for reservations so that it can take you to your vaccination if you are, again, a senior citizen or a disabled resident. Disabled meaning at any age, senior citizen 65 and older. You call Paratransit to make a reservation. It's, making a reservation. You can't just, expect to get it at a moment's notice. 995-7272, and that line is available 24 hours prior to your vaccination date, so that the reservation can be made and you'll be picked up and then taken from there. There's information on the homepage of our westchestergov.com website. You can take a look at that to get more information about that. But we want to make it sure that if you have a disability, if you are of a certain age, there's no impediment in getting to the vaccination. We want you to be vaccinated. We have plans to vaccinate those who are truly homebound, those that cannot leave their houses. But for those who can, but for which it's difficult, the Paratransit connection now is available to be able to get you to your vaccination shot. Again, 995-7272 is the line that you want to use in order to make the shot. I'm going to ask Ken Jenkins to join us next to talk about mobile testing units as they make their way around the county. Ken?
Thanks, George. And while, as the county executive mentioned, the vaccinations continue, eligibility continues to increase, as well as the number of vaccinations that we have here available in Westchester County increase, we still need to do testing. And we have had a mobile testing unit partnership with Westchester Medical Center, WMC, and we first want to start and give them a big thank you for all of the work our friends at WMC have done with their mobile testing unit, specifically James Kreco, Sokana Silla, Marie Yezo, and all of the nurses and staff who help run the operations. It is not something that is easily done. The Westchester Medical Center mobile unit has tested close to 1,400 people, 1,390 since December 10th, across 12 sites across Westchester County. They were extremely helpful when we had the yellow and the orange zone designations, as we were able to have testing brought directly into the community. And again, as the county executive continues to point out, the more vaccination sites that we have available, we also need that testing and in the community, wherever those folks happen to be, whether it's at a pop-up site, whether it's a mass vaccination site, same thing with the test units. We have had from Westchester County, Glen Island Casino, Glen Island facility open for testing right from the very beginning. And now WMC's mobile site. Elmsford, the village of Elmsford, in another town in the great town of Greenburgh, was the 12th site. So again, whether it was in Portchester, Ossining, Peekskill, Sleepy Hollow, Tarrytown, New Rochelle, Mount Kisco, Mamaroneck, Mount Vernon, New Rochelle, West Harrison, Dobbs Ferry, or Elmsford, our friends at WMC have been able to get those mobile testing site units out. And as the county executive said, as we get towards June and we start having people that haven't got over the 75% number for herd immunity with vaccinations, again, we have to continue to test. The travel advisory from the governor says that you have to have testing done at specific locations if you don't have the ability to opt out because of vaccination. So the mobile testing site is critically important, and we thank our friends at WMC as we continue to use it. Thanks, George.
Thank you, Ken. So the quick recap of our information on the pandemic, we have 5,200 active cases. Our hospitalization numbers are in the mid to upper 200 range, below 300. We've vaccinated now over 175,000 vaccinations in Westchester County, and we're approaching 30% vaccinated with at least one shot. All of that is progress being made over the last week. We're nowhere near the end of this, but we're certainly moving in the right direction. Hopefully that will continue in the next few weeks. We'll give you another update on these things on Thursday at 2 o'clock. I also want to mention this Thursday we will have a virtual event that is of some great note coming during Women's History Heritage Month. It's the WOW, W-O-W, capital letters, Conversations Conference. Begins at 4 o'clock, and you can be part of it online. This conference is a celebration of the power, the strength, and the independence of Westchester County women. The county will be paying tribute to a number of local women with certain awards, and we're honoring 7 individual women for a variety of their different accomplishments in the county. Those that have been involved in health and wellness will receive the Healing Hands designation. Women who work with children in education or child care will Next Generation indication. Showcasing a local woman who continues to lift others in women supporting women. Identifying women helping the community with basic needs like housing and food. That's the Community Response Award. Those who are providing spiritual guidance, keeping the faith. those who are outstanding businesswomen or entrepreneur or business recognition, and we have a special award for an outstanding teenager. So there's going to be women who will be spotlighted. We'll have some very special appearances by a number of other individuals, all held virtually. If you're interested, communicate with our communications department at communications@westchestergov.com, and you'll get the information so you can participate in this virtual conference. Sherry Asher, Martha Lopez, Crystal Collins of our team have done a lot of terrific work in trying to get this together. They will very much enjoy having the presence of a lot of dynamic women out in the audience, as well as those that are going to be spotlighted. That's coming up this Thursday, March 25th at 4 o'clock. As I mentioned before, we'll be back on the air at 2 o'clock on Thursday with an update similar to what we have now. Hopefully the news will continue to be good. Let's check and see if we have any questions from our friends in the press. We do.
We do.
Catherine Chaffee.
So our first question comes from Samantha Crawford from News 12 Westchester. She asks, New Yorkers who are 55 years old and older will be eligible to be vaccinated starting tomorrow. While the vaccine allocations have grown, is there enough to keep adding people to the eligibility list this quickly, or will this only make it more difficult for people to get an appointment?
That's from Samantha Crawford, News 12. Actually, the number's 50 years and older. And, we have, as I said earlier on, we still have more demand than we have supply. But for those folks who have already been seeking to get appointments, who have been eligible up to now, they've had the opportunity over some extended period of time. The 65 threshold, which was the prior threshold, then down to 60, has been around for a while. So we think it's a reasonable expectation now, as many of those people are satisfied, not all of them, is to open it up to the next cohort. Obviously, we are still going to have a scarcity of vaccines for the total demand immediately. People will have to make appointments, will have to wait a certain amount of time, but the vaccines are becoming more available with each passing week. So I think we'll do fine at this new level. And ultimately, we have to open it up to everybody. And I'm following what the president said, that by May 1st, he hopes that eligibility will be open for everybody. We are almost out of the month of March. So within the next week, 10 days, we're out of March, and then just the month of April follows, and then hopefully we will be open to everybody. So I think, Samantha, we'll have a reasonable opportunity, and I think those people who are 50 and older that have been waiting for this length of time will respond quickly, and we'll be able to use up the vaccines we have, which will give us the argument for more vaccines from the state.
And the next question and the final question is also from Samantha. She asks, can you please remind people who are 50 years old and older where they can go to get vaccinated?
Well, we have Samantha Crawford's second question, sort of gives me a chance to recap what the options are for getting a vaccination. If you go online to the website by New York State, you can go, and they will show you the availability to get an appointment at the county center, and I believe the Yonkers Armory as well. And those are the two major vaccination sites, large volume vaccination sites. Westchester County has two clinics, one here in downtown White Plains, and a larger one located temporarily so at the Westchester Community College in the gymnasium. That's on the Greenburgh Mount Pleasant border. Local pharmacies get allocations as well, and you're eligible, as you heard me say earlier, if you're eligible by age or eligible by comorbidity. We post that information each week on westchestergov.com whenever the governor makes that allotment. So go take a look and click on to see if there's a pharmacy in your area that you can then reach out to as well. And then the final avenue is by dint of your occupation. If you are in any one of a number of occupations, all those eligible occupations are identified online. If you're a hotel worker, restaurant worker, if you're in anyone in a major public contact role, grocery store, we're long past the first responders and the teachers, certainly, as we're working through, but now we're into other areas where you have public contact as an employee. You're also eligible. And all of those things are available online. You can take a look. And if you are eligible, get online, try to make an appointment that way, contact through your workplace if you're an eligible employee through your occupation, and they should be able to be helpful. And we're certainly going to do our very best to make sure that every vaccine we get goes out in people's arms, first shot, second shot, and get us to the point where we can really put this pandemic behind us. So if there are no other questions, you're welcome to contact Catherine Chaffee, our Director of Communications, 995-2932. I'm George Latimer, County Executive. Thanks for watching. We'll be back on Thursday. We'll give you another update. And if there are any issues that are breaking between now and then, we'll certainly come back to inform you. In the meantime, take care. Stay safe.